Yeah, relax. Hey, everybody. Dr. Herman, Guru Chiropractor, peace and love. Back again for another video. I got my new patient for the day, Mr. Brian G. What's going on, sir? Welcome, welcome. He's one of those YouTube guys. He researches and watches all the big YouTube channels for chiropractic. And I love people like that coming in here. It just makes my job easier. A lot of these guys and girls that are watching know more than some chiropractors out there. I'm not pointing fingers at specific people. So it just makes my job easier. They know what they want. They're educated about chiropractic. So it goes really a lot smoother. So I'm pretty psyched about that. Mm-hmm. He's got a little stuff going on. I want to go over what we went over in the health history. So it's got some lower back pain. That's your primary issue, right?
Yes.
He's pretty young. Can I tell him how old you are?
I'm 26.
Well, you tell him. 26. And he's had lower back pain, folks, since he's 14, 15 years old. So yes, you can have back pain as a child, as a teenager. I've treated infants, not necessarily back pain, but a lot of babies and infants get neck tightness, neck stress. I've treated from cradle to grave. Everybody on the planet can have back problems. So it's pretty chronic. I would say, that's been about 12 years, right?
Yes.
I would rate that chronic. It hangs out on the average at about 2 or 3 out of 10 pain-wise. So that's mild, but it's constant. It never goes away, right?
Mm-hmm. Yeah.
So that kind of sucks. Mm-hmm. I'm going to do everything I can to make that difficult for you today.
Hopefully.
Yes.
Sounds good.
He had a pretty nasty auto accident, 2 years ago?
Yes.
2021 in Manhattan. He was hit by a New York police officer, and he was driving one of those Vespa little scooters, right? So pretty nasty, got a concussion, some head injuries, and all banged up. Nothing fractured, but all banged up. Right shoulder's pretty messed up, so we're going to, and the neck on that right side, so we're going to look to see if we could help that out. And what else did you say? And his big toes hurt. I don't know what's going on there, but I'm going to take a look, and we'll do a good adjustment on the toes, see if that helps him too. So I'm going to do my very best. We're going to probably do the ring dinger if you qualify. I'm assuming that's why you're here, right? Yeah. So let's do a good exam. Let's see what shows up there. Mm-hmm. We'll talk through it. And then at the end of the exam, we'll confirm which way we're going to go with the treatment.
Okay.
And then we'll do it. You let me know if anything I'm doing to you doesn't feel right. Otherwise, your job is just relax. Let me do my job and we'll get it done.
All right. Sounds good.
All right. So let's move this because you're going to go on. Actually, I lied. Let me put this down. I'm going to go. You stay right there. I'm going to come behind you and I'm going to do a neck and shoulder exam from seated. And then we'll lay you down and we'll check the lower back. Okay? So stay relaxed, square off a little bit, make sure your feet are flat. Yep, good. So let's see first about what's going on in this neck. So right off the bat, and probably the camera can see it, but you got a pretty significant head tilt to the right. Now go in front there if you could. I want you to go front view. I don't know if you could see. Look at the ears. See how high this one is compared to this one? And if you could just see in general, his head is tilted to the right. The right side of his neck, he complained of being way tighter. So usually when you get tight, it pulls you down. So that makes a lot of sense. And yeah, when I push in here, these muscles, the SCM muscle and the upper trapezius muscle are pretty spasmed on this side. Okay. So let's see how well your neck turns. So let's turn to the right. It's not too bad, a little limited. Here's where you stop. Normal perfect should go here. So it's not horrible. This one's a little tighter, but usually it's because the opposite side is tight. So see how this stops here? Should be able to go about here without any effort. If I stretch it a little bit, does it bother you on that right side?
Just a little bit.
Yeah, okay. How about this side? If I stretch it a little bit, does it hurt anywhere?
Less than the other side.
Less, yeah. This side is really jammed up. So let's tilt to the left. Yeah, way tight in here. Way tight. Let's tilt to the right. Not nearly as bad. Probably the camera can see how far it goes. All right, let's go backwards. Head backwards as far as you can. Looks like it's a little jammed. Do you feel tightness and jamming in here?
Yeah.
Any dizziness or good? That's a good sign. Bring your chin down as far as you can go. Anything pulling here or does it even pull down in your lower back or no?
No.
Good. Come on up normal. So the next thing I want to do is what's called the cervical compression test. So I'm just going to push down on your...
Can we keep the fan on?
I see you're sweating, bro. Could you go over, Zach? Yeah, move over so we can get the fan going. I need it too.
Yeah. I always keep the AC on max.
Me too, man. I'm always running hot. You want it right on you or you want it to oscillate?
It's fine.
It's fine like this?
Yeah.
All right, back to work. So I'm going to push down on your head like boom, boom, add some compression. Let me know if that flares up any discomfort whatsoever. Okay. Sit up a little straighter for me. I was looking at your face. I saw you were sweating. How'd that feel? Anything go ouch when I did that? Like more so than it
just got tight.
Tighter there? Yeah. Okay. You definitely have compression. I already could tell in the neck. All right. Now I'm going to do the opposite. I'm going to stretch your neck up and just hold it for like 5 seconds. Nothing jerky, just a stretch and hold. Let me know in general how that feels. Like, oh, I like that. It feels like I need more of that. No different, or I don't like it.
Okay.
Stay relaxed. How's that make it feel?
It felt good.
Better?
Yeah.
Yeah. All right. Me and you, I could tell. I'm going to put this up a little bit more. You're out here. I'm going to stop it right there. I need air too. All right. You did that. We did that with that. I want to do a little shoulder exam. So just let me move it. You be dead weight. Yeah, it's a bit tight. See how I don't want to go up any higher? Yeah, let's see. Let's compare it. Give me this one. Relax. Not too much of a discrepancy. This side's tight too. A little bit looser. I'm going to do some muscle testing for the shoulder. So I'm going to ask you to put your arm in a certain position. Then I'm going to press in a specific direction. Okay. I'll let you know all that ahead of time. Your job, resist me when I press. Don't let me move it if you can. And also let me know if there's any discomfort when you do resist it. Okay. So first, just take it straight out sideways. Always stay squared off looking forward. I'm going to push down. Don't let me. Ready? Resist. Good. Strong. Any pain?
Yeah.
You felt pain when I resisted? Okay, bring it in front now. Hold here. Don't let me push down. Push up. See that one? That's wobbly. You can't keep it locked. Any pain though when I push?
Yeah.
Yeah. So that's more of the anterior deltoid. Now turn your palm upwards. Keep your elbow locked and don't let me push down. Ready? Resist. That one doesn't seem too bad, but was there pain?
No.
Okay. Now bend your elbow. Bring your elbow up and don't let me push your elbow down. Ready? Resist. That seems pretty strong. Any pain?
No.
Okay, bring it back out sideways. I'm going to check a little bit. You didn't really point to it, but I'm going to check a little bit for the posterior shoulder. So I'm going to try to pull forward. Don't let me. Ready? Push backwards. Now that's nice and strong. Any pain?
No.
Halfway down. Again, don't let me pull forward. Push back. Ah, nice and strong. No pain?
No.
All right, so there's definitely something going on here. Possibly could be AC joint. Is that sore?
Yeah, right. That's where it hurts.
That's the AC joint right there. So it's possible. I know a little something to help that and the shoulder itself. And like we talked about off camera, I highly, I've seen it over the years. Neck and shoulder are always intertwined. So sometimes just clearing out the neck will help tremendously with the shoulder discomfort. Hopefully that'll be you.
I hope so.
I'm going to do my best. I'm going to do my best. All right, let's go. Let's check your lower back. So I want you to go face down. Put your face here, hands on the side cushions, and get settled in and relaxed. Good. Oh, sorry. I got to get your microphone. Lift up a second. I always forget this damn thing. All right, come down now. Relax. Good. Good. All right. So now I'm going to just look at your posture as you lay here. It's not the most ideal way to evaluate posture, but I do get some data that helps me sometimes. It really doesn't look too bad from here. There's not really that much distortion in little bit higher here. That's probably from the extra tightness. Like your shoulder blade is a little higher than your left shoulder blade, but very insignificant. Now your hips are level because your heels are level. And I don't see too much of a torque. I'm going to do an orthopedic test. I'm going to bend up your knees, right? Normal, you should stretch in your quads. You shouldn't really feel anything here if it was normal. But if I bend it and you feel this getting tighter or more discomfort as I bend up, let me know. Got me? All right. Let's see. Bend up. What does your lower back feel like when I do this?
It's starting to tighten up.
Gets tighter as I bend? Okay, so that's a sign that there's too much compression where you felt the tightness. Where'd you feel it? Here? Yeah. So there's lumbar compression. That's pretty much confirmed. And there's definitely cervical or neck compression. So already I'm going to tell you, you definitely qualify for the ring digger. Yeah. And then when I feel down here in your pelvis and your sacroiliac joints, the right side to me feels tighter. Can you tell the difference in pressure here when I push? This doesn't move at all. It pushes back on me. This has a nice, decent wiggle, a nice, decent range of motion, but this one's kind of stuck. All right, let's see. I'm going to press down on your tailbone. Start on your left leg. Don't bend it at the knee. Lift it up as high as you can. This will evaluate the range of motion of your SI joint. Okay, good. Bring it down. That looked like it was pretty nice. Now do the right side for comparison. Yeah. Okay, go down. Already I saw it stopped like only 3/4 away compared to this, how high this one went. How did it feel to you lifting comparatively?
So much tighter on the right side.
There you go. So that confirms it. Right sacroiliac jammed up. Jamming. So sacroiliac syndrome, sacroiliac subluxation. These are all names for the same beast. But the good news is I know how to fix it. So we're gonna definitely release a lot of jamming going on in that lower back. And I believe that's gonna help you a lot. Now when I push here, is there any soreness? Like tender when I push on it?
No,
kind of like you feels good. But does it feel like you're pushing on like a bruised up area? Like tender?
Yes.
Yeah, it does, right? Here? Yeah. So that's a sign. Also, not only is there jamming, but there's also irritation, inflammation. How about out here? Anything sore when I push? Tender? No? How about on this side? No. Nada? Okay. Now I'm going to go up the spine. Just do a general feel. And if anything feels abnormal, I'll stop and we'll talk about it. So everything from here to here feels pretty good. Then when I get right about here between the shoulder blades and up, very rigid here, very tight right there. Can you feel this? Yeah, all the way up. Boom. Basically your whole just about your whole thoracic spine is pretty jammed. Is that sore here?
Just a little.
A little bit compared to this side?
Oh yeah.
Yeah. See the difference? This side is really spasmed and really compressed. I'm willing to bet money this is definitely contributing to your shoulder. Okay. All right, good. So I'm done with the exam. I'll write my notes later. The bottom line is nothing showed up for safety, so I feel 100% confident it's safe to treat you. And you definitely have chiropractic issues that I deal with on a daily, so I'm feeling like this is going to do really well for you. I'm ready when you are. You ready?
Yes.
Excellent. So here's the game plan. I'm going to just stretch you out right here. Just do a little loosening and massage, a little stretch. Just kind of like warm up the muscles, get you ready for the big stuff. Then we're going to go do the big stuff. Then we're going to go in the back room and you're going to get your first ring dinger. And then once that's done, you're going to see, I don't want to spoil for you. It's an amazing experience for most people. But it doesn't get everything. It just gets the compression out this way. And then anything else that's jammed, we come back on this table and I handle all the rest of it here. So then you'll come back on this table, lay down, and we'll do a full spine release and then full body joint wise. So that what that means is the ankles, the toes, the arches, the knees, the hips, the wrists, the fingers, the elbows, the shoulders, and of course your back. You'll be walking out of here feeling better. At least that's my intention and my goal for you. Your job, just let me know though. I'm just reminding you, anything that I'm doing throughout the whole rest of the visit, if it don't feel good, you gotta let me know. And I'll stop right away and we'll fix it. What's your nationality? Korean?
Yes.
Were you born here or there?
In Korea, I came here when I was 1.
Oh, okay. So you have no memory over there, right?
Nope.
Did your parents teach you Korean though? Can you speak?
Yes, I learned Korean first.
First, so that was your first language at home?
Yes.
Cool. You got family over there? You ever go back for visits?
Yeah, I only visited once or twice.
Nice. Good. All right, now we're going to use the massager that I love called the Thumper, thumper.com. Good, solid massager. No, I don't get any money if you buy one, but I should. Should get one of them, what do they call that? Affiliate sponsorship, something like that. You get one of those affiliate links. So if they go on your site and they click on the affiliate link and they buy it through that link, then you get a kickback. I know how shit works. I just don't do it. Now this thing's blowing a little bit too much. I'm going to oscillate it. Did you do sports growing up?
Yeah.
What was your main sports?
Soccer and basketball.
Oh, cool. Good. Nice. Okay, give me a second, and then we're gonna get you up and go. We're gonna go back in the ring dinger room. But I gotta go over there for a second. I gotta pull out a sheet that I forgot to get you to sign. Just before you leave, we'll sign that. All right, come on up on your feet. We're going in the back room for some back room stuff. Come on through. Don't trip on the lip. Give me a second.
Well, I actually forgot to mention, like, in the past maybe year or two since I've been putting on a little more weight, the pain's gotten a little worse in my lower back.
Yeah, you know, the little bit for people that already have back problems, adding weight to it, it doesn't really ever do any good for them.
Yeah.
But all right, so what I want you to do is lay on your back, face head here.
Okay.
So face up, head on the no paper today. Hands up here. I got to feel your hips for the top of the iliac crest. You got a high one. Look at that. Now slide your body down about 3 inches towards your feet. Perfect. That'll work. All right. Now the table's just going to raise up. You don't have to worry. 3 days till I'm going on vacation. Now the legs are coming up. Just don't wiggle. Let it bring it up for you. Let them bend. Let them relax. Let them relax. Good. So, 12 years of constant back pain, huh?
Yeah.
All right. We'll see what happens after this pull. Now I got to pin you in pretty tight, right above the hip bones. It's going to be snug, but it's got to be to get that full release. And you might even get taller. How tall are you?
5'10".
5'10"?
I'm like this much off 5'10".
Yeah. You might be 5'11", maybe even 6 foot on the way out of here. Can you handle this tightness right there?
Yes.
Good. Now, let me have your hands back to me. This is not the treatment. I'm just making sure there's no space between your hips and the pins. Perfect. Now rest them down again. Perfect right there. The towel goes around your neck, but really grabs. I like to have people feel it. No, relax. It grabs the back of your skull and your jaw and pulls like this. But my hands are too small to get a good enough grip. So this gives me better leverage. In case you was wondering. Let me re-roll. Good. Lift up your neck and come down. So it does go around your throat. I'm going to move this down a little bit because it might get in the way. It does go around your throat, but it shouldn't be choky. So if it gets too tight on your throat, just let me know. How's that?
Fine.
Okay. Now, your job, major thing you have to worry about. Just keep your teeth touching together. Don't keep a loose jaw. Don't bite super hard, but just keep them together. So when I pull, I don't want you to bang your teeth or, God forbid, get your tongue in there. That would be nasty. You ready?
Yes.
Okay. Stay as relaxed as you can, and I'll do the rest. Zach, you want to get the face one today? I like that one. We'll do that today. Give me 5 seconds. I'm just saying a little prayer, and I'm relaxing, and I'm visualizing the perfect pull for you. Okay. Here we go. Just getting a grip first. Nothing happened too soon. No sneaky stuff yet. Notice I said yet. Stay relaxed. Just going to give it a little traction. Stay loose. Oh. Breathe.
Wow.
Big one. Describe what you felt.
I felt it along my whole entire spine.
Released?
Mm-hmm.
And did it all pop like? Pop, 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 pop all the way down? Or just stretch?
Just stretched. I didn't feel the pop.
You didn't feel the pops?
No.
That means I have to do another one. I'm kidding. All right, coming down. Sometimes it pops, sometimes it doesn't. The bottom line is it opens up the compression. It takes away a lot of that squeezing compressive force, which is what usually the main problem that causes back pain. So it gets rid of that. Now, don't get up. Stay right there. I'm going to lower the table. And then I want to do a little more release in your neck. And then when you're ready, we'll get you up on your feet, see how you feel. No pain?
No, it caused like a burning sensation in my lower back. But
yes, like a warm, hot burning. Mm-hmm. That is very common. A lot of patients report that. And I see when people report that, usually they're doing better. Like that means it was a good, successful release.
It feels better.
Nice. All right. So now I want to do the neck pop, particularly that right side. You ready for that now? Some people need a little time to chill. Stay loose. Good. Woo. Let's get that right side really good. Nice. Painful?
The right side felt a little tighter.
Yeah, it was way tighter. But guess what? Way looser right now, baby. All right, I'm done here. So when you're ready, come on up. Take your time. If you need my help, I'm here. You need help? No. Good. When you stand up, I want you to stop and kind of just put your attention into your body and your back, evaluate it, and tell the camera what you feel. What feels different?
Wow, it feels a lot looser.
That is music to my ears. That's exactly what I want to hear for a successful release. Looser, more flexible. Mm-hmm. Were there any motions that you would do that would really pull or make it feel worse, like bending forward, bending sideways, bending backwards? If it was, try it now, see if it feels different. Do you feel more flexible going down?
A little bit. It feels good though.
All right, good. I'm happy with that. Good job, dude. But there's more to do. Remember I told you now we got to go back on that table. So go face back down there. Wait. Now go down on your belly. Okay, hands on the sides, right? Good. Now, remember when I bent them up? You said it was pulling here? Let's do it again and retest it to see if there's any changes here. So when I bend it up this time, if there's anything different than the first time we did it, let me know. Bend. Stay relaxed, bend up. Now, how does it feel now in the back when I do this compared to the first time?
Less tight.
Good. That's what I'm looking for. But still some pulling? That's the common response. That's what most people have happen. It goes from, something to reduced. Occasionally, it goes from something to nothing with one pull. Everybody gets all excited about that, but that's not the norm. Good movement there. Better movement here, but not all the way good. So I'm going to do a lot more work here on this table to release more of the sacroiliac and some more in the lumbars. So what we're going to do now is the drop down technique or the push down. The belly drops down to give me more space to push. This part pops up, and when I push on you, the drop adds speed to my thrust. And if you know anything about physics, speed overcomes resistance. Same thing if you're a martial artist, you know that. So the more speed I can use with the thrust, the less force I need to use, which makes it safer and more effective. So this dropping mechanism, that's basically why we do the drop. It adds speed. Ready? Stay relaxed. Good. We're going to do more. Good. Relax. Good. There we go. Yeah, you don't pop that loud. Some people just genetically don't do a lot of pops. But the popping sound does not mean it's successful. There's many times I do adjustments and it doesn't pop at all and the patient gets completely well. So don't get too attached to having to hear pops. everybody loves those pops, but it's just a byproduct of moving the joint. Get some air popping out of there. It's kind of like your joints burp. Now, can you tell? Now we got some good motion in the ocean, baby. That's good. Okay. Let's recheck the range of motion. So start with your left leg. Don't bend it. Keep it stiff. Lift it up as high as you can. Good. Go down. That was good to begin with. Let's see how this goes. Go up. Look at that. And down. Visually, it went up almost even to this side now. How did it feel this time?
A lot looser, but it's still a little tighter than the left.
Yeah. Well, two things. One is I'll do a little more to see if we can get some more. But really what I want to say is don't expect perfection from one visit.
Oh, yeah, I'm sure. I had to stay for 12 years. So.
Progress, yes. Don't expect you to be completely pain-free and feeling 100%. Although it does happen sometimes, but don't expect it. So I'm going to do a side posture adjustment of the sacroiliac joint only to see if we can get some better motion here. So what I want you to do is lay sideways face me. So turn all the way on your side. Again, this damn thing. Sorry. I'm going to tilt this up for your comfort. Tilt this way. Okay, now I'm going to twist your shoulders towards me. Mm-hmm. Now put your hands on your ribs. Stay like that. Look up a little bit. Now, the top leg bends. Bend it. Keep the bottom one straight. Now bring your butt closer to me. Good. Now listen for a second. I got to roll you this way to get on your hip. Mm-hmm. You're not going to fall off. Some people feel like they're going to fall off and they guard. Mm-hmm. You're not going to fall because I'm standing here. So your job stay as relaxed as you can be. Actually, you know what? Move this forward. Scoot it like, yeah, not too much. Now, a little backwards. A little back. Scoot the whole body back towards that way. Oh. Now come, relax. Okay. Now I'm going to roll you. Stay relaxed. Let it. Yeah. Felt that one? Amen, bro. All right, go back on your belly. Body position is also very important. That's why I had to tweak your position a little bit to get a good release. Look at that. This one, to me now, this one feels looser than this one, but we'll see how it feels to you. Lift it again. Good. And down. Any little bit more?
Yeah.
Good. Is it all gone or just reduced again?
Like 99%.
Woo, baby. All right. We're doing good. We're doing good. Okay. Lower back is doing phenomenal. I'm very happy with this. Now we're going to release more in here and work more on that neck. So the belly part comes up. This part pops up. And when I push on you, it's going to release through here. So stay relaxed. Good. Loose. Good. Nice. Look straight up to the sky. Tilt sideways. Let it go. Nice. Back in the middle. Do the same thing on the other side. Already it's looser. Much better here. Look up to the sky and tilt to the left. Good. There we go. Nice. Very nice. All right, Mr. Brian. Face up for me. Roll over. Da-da-da.
That was a huge release on my neck.
Yeah, good. And that might help the shoulder too. So now, let me have both hands back to me. We're going to do a little stretch. Stay relaxed. Let it go. Let it go. Any more release? Sometimes it gets the lower back a little bit more. Yeah, good. That's a baby dinger. I didn't name it though. So Dr. Johnson hears it. Don't get mad at me. One of my patients called it a baby dinger. You okay getting your toes popped?
Yes.
Stay loose. Good. Nice. Good. Nice. Now we're going to do a little. This is the ankle that you had. Did they put plates and screws in there?
Yes.
Is it still?
No.
Okay.
I got removed over 10 years ago.
All right. I think it's okay to pull. You okay if I give it a tug? Okay. Drop it and loose. Relax. Oh, yeah, that exploded, man. So you might expect to get a little bit better range of motion here now. Drop it. Yeah, that one went good too. Nasty. Good. All right, almost done, sir. All the big stuff is done. Sit up when you're ready if you need my help. Swing around, face that way. We're going full circle, baby. Full circle. Okay. Your head is only slightly tilted. It's way better than it was. Way straighter. So that means, and your shoulders are pretty much even. So that tells me a lot of stress has come out of here.
Yeah.
Not all.
My hand feels like weightless right now. Wow.
Actually, you know what? As I feel here, I want to adjust your collarbone. So what I need you to do is go back on the table, face up. Lay down on your back. Just want to get a complete release. Scoot your body down like 3-4 inches. Keep going. A little more. Right there. Good. Now I want you to bring your arms out like Jesus on the cross. Or as one of my patients said, Jesus playing lacrosse. We're going to do both sides since you're here. So turn this way. Stay relaxed. Good. Turn the other way. There it is. Woof! Big one. Just a little bit in the chest, in the breastbone. A little gentle one. Good. Good. Now bring your hands back. Actually, sit back up. Swing around. Woo! Move that shoulder around. See, does it feel looser? It's still making that noises, though, huh? All right, we're going to adjust it now in a second. See if that helps. We're going to start on this side first. So we're going to do shoulder, elbow, wrist, fingers, both sides done for today. Start here, bend up in front. I got to hug around you, get my hands underneath your elbow, and pop it.
Okay.
So don't punch yourself in the face. Relax. Let it go. Relax. Good. Let's get this one. Relax. Good. This one was noisier than this one, right? Sometimes a little bit in the elbow, nothing crazy. Relax. Good. The wrist release. Good. And pull towards you. Ready? Pull. Good. We want to give you any more whiplash, though. Good release. Drop it. Let it go. Good. Relax. Good. Boom. Finishing up the icing on the cake, baby. Okay, I'm done, sir. Now, how do you feel? What is your impression of how you feel now compared to before?
So much looser.
Good. It's still making noises.
Yeah.
That's hard. Sometimes they don't go away. Sometimes they do after a long, a bunch of visits. So, that's right. You said, I forgot to say on camera, he was getting a lot of pain when he threw a ball. Now that motion's
Oh, come on.
I love it.
Wow.
Dude, you could start pitching again for the major leagues. Dude, that's exciting.
Yeah, the cracking's there, but
the pain's gone.
yeah. Mm-hmm.
All right, cool. I wouldn't push that shoulder. Don't go out and start pitching today. Let it heal a little bit. Let some time go by to let it heal and stabilize.
Wow.
But that's a pretty major. How about that lower back? Because that lower back is the chronic stuff, and lower back's more important than shoulder. Because when your lower back goes, you can't even function in life. How's that feel? Any better?
Yeah, it hasn't felt this loose in years.
Friggin' men to that.
Yeah.
Good. All right, listen. I don't know, but probably you're not 100% fixed, just based on statistics, right?
Mm-hmm.
So what I would suggest is go home, let 2 or 3 or 4 days go by because your body needs to heal and repair after the treatment. Then make a decision on how you feel. If you feel at that point that, yes, this made a pretty significant impact and improvement, but it's not all the way gone, like you still feel like there's still stuff going on, that basically means you need to come in for a couple more follow-ups usually. So if you choose to do that, then try to get back next week. And if you can't get back next week, I'll have vacation. Get back the following week, like the second full week in June. I'll be back.
Okay.
The 12th through the whatever 17th, 18th. Try to get back in that week, and we'll do a follow up. We'll see how you do. We'll do another adjustment, and then we'll just see how you do from there too. That's how I do it with my patients.
Okay.
One visit at a time, and then we make new decisions based on how you are after your body heals up, and then we keep doing that until you make maximum correction. Simple as that. That's how I do it. So, any questions? Any comments?
Oh, you cured my toe too.
What? I didn't even realize the toe. I forgot about the toe. I just went through my normal routine on the toes. Feels better? Look at that. You think I should call myself a toe expert now?
This visit was worth it from the toe alone.
Just from the toe alone?
Yeah, it felt broken for years, but now it's...
Dude, that's crazy good.
That's crazy.
I'm very happy for you. I'm happy when this happens. It doesn't happen all the time. I want to let people know. I'm not a miracle worker. This doesn't happen every single time, but a high enough percentage where it's friggin' awesome.
I had another chiropractor do something similar to the toes, and the pain was still there, but you got it.
Listen, I had a little conversation with those toes when you weren't looking, and I made sure that they were going to respond. Gave them a little... It's not just messing. Dude, I'm pleased. I'm really pleased. Yeah, so you understand what we talked about too? If you get sore, some people get sore from that pull, ice will be your best friend. Ice, if anything weird happens, it does happen occasionally where something gets a little turbulent after a deep adjustment, meaning a new symptom or a flare-up or anything that feels weird that's different than before. If that happens to you, just reach out and let Zach know.
Okay.
And then he'll tell me, and I'll get on the phone with you, and we'll do a check-in just to make sure you're okay. Simple as that. All right, it was a pleasure meeting you. I appreciate you coming by and driving 45 minutes to come by.
Yeah.
Was it worth it?
Awesome.
Let's say goodbye to the fans out there. Big Brian, feeling a lot better. Dr. Herman, Guru, peace and love. Listen, you watched it. If you relate to that, if you're suffering and you want to come through in Edison, New Jersey, come see me. I would be honored, and I will do my very best to try to help you too, just like this guy. The best way to reach out is my website, retrochiropractic.com. There's a book now link in there. Just enter your name, your phone, your cell phone number, your email address, and it goes right to my assistant, and he responds back to you when he gets on the clock, and you guys can work out an appointment, answer any questions that you might have. And if it's meant to be, come on through, and I'll help you out to the best of my ability. I love and appreciate everybody out there. Have a great day. Peace.